I came to see Dr. Sims, and as I was being diagnosed with valley fever, I felt hypoglycemic most of the time. I was fatigued. I was diagnosed with hypertension. I was overweight. I felt dizzy a lot of the times, and my medical doctors couldn't seem to put everything together and tell me what was wrong with me. I was sent to see a cardiologist. I was sent to see an endocrinologist. I was sent to have blood work done, and it appeared to me that they were grasping at straws. They really didn't have a good answer or a plan for me to work towards getting better, and that's what Dr. Sims did for me. I was seeing an endocrinologist for my hypothyroid, and I had just been tested in March before I injured my back, and the endocrinologist told me I was within the perfect range for my thyroid medication. But I said to her, well, then why am I so tired? And she said, well, I don't know. We have to explore other options. Yeah, valley fever for me was extreme fatigue. I woke up tired in the morning, and I was tired all day at work, and I was tired at the end of the day, and I was always sleeping. My medical doctor did a blood test and discovered that I had this valley fever, and subsequently recommended that I rest a lot.
Hi, my name is Dr. DeJarra Sims, and I'm a naturopathic physician here in Phoenix. I'm a graduate of Southwest College of Naturopathic Medicine in Tempe, Arizona, and I have been practicing for 4 years. I always tell my patients that a journey of 1,000 miles begins with one step, and that being the case, they usually come in with a lot of different disease processes going on. So we treat the most pertinent disease process first while addressing the underlying cause of disease. When Wendy first came to see me, she had recently been in the hospital for 4 days. She was diagnosed with valley fever, and she came in with fatigue, extreme weight gain, hair loss. There was some itching all over. She had a cough, and she just wasn't feeling well. In her very exact words, she said, "I feel like crap, and no one seems to know what's wrong with me." Wendy was an amazing patient because we got to actually put her on many different naturopathic therapies. We actually started out with acupuncture and doing IV nutrient therapy. That didn't really resonate with her well. She saw the best results from dietary and lifestyle changes, and also nutritional supplementation. A lot of the things that we used were things like multivitamins and fish oils. We did different things to help her sleep better because she was actually taking sleep medication. Now she's completely weaned off of her sleep medication. She no longer needs any of her digestive medication. She's treating it all naturally. She sleeps 9 hours a night. She no longer has any digestive issues, and she just feels great and energetic. So there are about 5 meds that she's on, and out of those 5 meds, she's only on 1 of them, and we're currently in the process of weaning her off of that.
So we eliminated dairy from my diet, and in fact, in the space of probably 2 weeks, I already started feeling better. I didn't feel as inflamed, I didn't feel as bloated, and I started recognizing that my back pain was diminishing. So that was a revelation to me. I just couldn't imagine that something as simple as the food that you eat could be hurting you somewhere else in your back. After I had been treated for a couple of months and came in to see Dr. Sims and of course the students, and I loved my students that were treating me during that time. And they were my biggest fan club, and in the course of describing how I was feeling, and I said, I think I'm getting up there towards an 8 or a 10 on energy level, I told them, I said, gosh, just a few days ago I was able to think about going to the gas station and putting gas in my car all by myself, which I hadn't done in months and months and months because I'd been so tired. And they were just like cheering and telling me how great that was, and I was saying, you guys are so awesome, and you're such a fan club, and you really are, helping me work towards getting better. So that was great.
I love being a naturopathic doctor. What I love most about being a naturopathic doctor is not only can I diagnose and treat patients just like any regular doctor, but I also have more tools in my toolbox. I actually can use hydrotherapy or acupuncture or herbal medicine, supplements, dietary and lifestyle changes, homeopathy. There's so many different ways that I can treat a patient, and I don't have to treat the disease. I actually treat my patient, and that's what I love about being a naturopathic physician. The first thing I would tell a prospective student is to actually know in their heart what they want to do. Do they want to manage diseases, or do they want to find cure? In my profession, we look for cure. We put people on a path to complete and total wellness, and we don't just manage diseases. We treat each patient individually, and they're not just a disease process. And because of that, we actually see complete and total healing of their diseases. So if you want to learn a lot about pharmaceuticals and you want to do surgery, maybe naturopathic medicine isn't the route for you. But if you want to find cure, if you want to have and develop relationships with your patients, and you want to really understand how the body works and what you can do to help facilitate healing, then naturopathic medicine is the right medicine for you.